Hi, my name is Lydia. I currently work as a department manager for Project Shine. Project Shine is a department in a healthcare that specializes in infectious disease, particularly in HIV care and STI prevention. So prior to that, I've done a couple of work with complex care, with elderly care, against infectious disease. And I'm currently in a very interesting period in my life where I am trying to really explore more of project management and the overlap between project management, self-care, wellness, and all of the different areas that are important for public health workers and advocates. Prior to my work and passion in healthcare, I've also worked in higher ed, I've worked in nonprofit, I've worked with the community, I've done a little bit of everything. So I'm really excited to bring all the different knowledges and experiences into the work that I'm doing right now, and hopefully into the work that we will be doing together in Ghana. So one of the things that I'm really excited about and really passionate is really exploring the opportunity that self-care practices and the focus on wellness really can be used to identify tools that can be implemented for individuals who are doing work in the community. So this can be, exploring and really diving into the impact of wellness and self-care practices on individuals. This can be the lack of self-care practices. This can also be the adaptation and the implementation of such practices, right? And really trying to identify some of the areas that are challenges, right? And some gap areas, right? And areas that we can do some reinforcements, right? And looking at that and looking how the research also points out at the impact that wellness has on individuals, right? It affects our mental capabilities, emotional capabilities and processing styles, also on a very spiritual sense. All of this, there's an interconnection of how all of this really impacts individuals. So I'm really interested in diving a little bit more into that, and then taking it a step further and trying to think of these not as, these are practices that are, so foreign to us, or, that I would need A, B, and C to implement them, right? But trying to say like, okay, this is a way, an opportunity for all of us to really think about how do we use these practices to build resiliency as individuals, right? But also resiliency and staff development, right? Like how can we use this in our staff meetings? How can we use it with our students? How can we use it in the communities or the spaces that we go to? So trying to really expand our knowledge and really expand how we perceive wellness and self-care. So really trying to dive into like all of these different areas and sectors in our lives. So I'm really looking forward to really getting to work with the staff and really getting to learn from them too, right? And what is it that they are doing, right? So then I can also build on my toolkit and also be able to share that knowledge with everyone. So. I think that I am really excited to be present and to experience, Ghana. I was there in 2014, so crazy that it was like 10 years ago, and I get to come back. So I'm really excited to see how the country has changed, how I've changed, really get to know our colleagues and really learn. I think that for me is as much as I'm thinking about, sharing different knowledges and practices, I'm really excited to learn. I'm really excited to learn, to see, like how is it that we can collaborate? How is it that we can grow together? And I think that's going to be very, very interesting.